Hi viewers, I am Dr. Aditya Somayaji. I am a consultant orthopedic surgeon, foot and ankle and arthroscopy and sports medicine and joint replacement surgeon at Yashoda Hospitals, Hitec City. Today we are going to speak about heel pain, which is a very common problem we see in a lot of people. Heel pains can be a lot of types. So heel pain can come under your heel, that is called plantar heel pain. Sometimes heel pains will come back of your heel, that is called posterior heel pain. The most common cause of heel pain is overuse injury. So there is a soft layer under our feet which protects our feet from the injuries, that is called plantar fascia. This acts like a shock absorber to our heel and foot. So whenever there is a lot of strain on it, like barefoot walking or a barefoot running for long hours without adequate protection, without taking adequate rest, these plantar fascias tend to inflame or swell. This leads to something called as plantar heel pain or a plantar fasciitis. People with this plantar fasciitis will have a morning stiffness. The pain, the moment you get up and get out of the bed, the first step is very painful, so because of its inflammatory nature. So this is the common cause of the plantar heel pain. And other population is you get posterior heel pain, the pain behind your heel. So that happens especially in case of athletes like running and all, where our muscle, one of the important muscle called tendon gets attached there, and that gets inflamed, and that leads to a posterior heel pain. The similar kind of problem with the morning stiffness and pain after walking for some time or running usually happens in the case of athletes and active population into sports and gym and all. So apart from this, you can also see these heel pains in an older age population sometimes, because the most of the common reason is the obesity, overweight, and you have something called as flat feet because of the loss of arch of your regular feet that is there, and diabetes and other injuries. These are the common reasons which you see in other populations. The most common modality to diagnose is the clinical examination. The moment the doctor sees you, generally they will come to a diagnosis and they will get to investigate it to rule out other causes of heel pain apart from the stress and all, like infection or when you have a arthritis problem or diabetes and other things. So they do some kind of blood tests. Sometimes you will have uric acid, hyperuricemia, that's called gout. Those things will also cause heel pain. So the moment you see them, they will get investigated, and sometimes they take an X-rays to see whether we are dealing with any bony problem. And the other modalities are ultrasound scan, which shows the plantar fascia gets thickened and all, and also it shows the condition of the muscle and which gets inserted into the bone. If required, sometimes MRI will be done. So depending upon the problem we are dealing with, usually most of these heel pains, something called as plantar fasciitis, which we already discussed, usually comes down with proper therapy, proper change in the footwear, and proper plantar fascia stretching exercise like physical therapy and physiotherapy will definitely help in reducing the pain, and 99% of them will reduce with the things. And suppose if you are dealing with a high performance athlete or a running people, sometimes to offload the heel by putting some cast or giving a good support, orthotic support, or giving a good air boot cast, something we call as, and immobilizing for some time will reduce the inflammation in the plantar fascia, and that will also come down. And similarly, you will have posterior heel pain, which we deal with, you are discussing, where the muscle gets attached and gets painful. So those things can also be dealt initially with the stretching and exercise. Okay, so these are the different types of treatments that are available, and definitely they are going to help you. Sometimes they will give an injection, something called as platelet-rich plasma, which is also helping, and surgeries are rarely done, but surgeries are effective if the patient is not coming down with all these modalities. Thank you.